Hi, my name is Dr. Emily at Peak Spine and Wellness, and this is another part to our low back series. And so the question today is, why do we take x-rays? And especially for low back pain. So the reason we take x-rays for low back pain is because there can be lots of reasons as to why you're having low back pain. So rather than guessing, we like to actually be able to physically see what's going on structurally. And because we specialize here in what we call chiropractic biophysics, meaning we're like an orthodontist for the spine, we take high importance in terms of what those curves physically look like. So in the spine, you should have this really nice lumbar curve, basically, which is your low back curve. It should be about 40 degrees. And so what can happen is you can have too much curve in that lumbar spine, which puts excess pressure on this back part and also those nerves, which can lead to that chronic low back pain. And we call this a hyperlordosis, which means too much curve. You can also have not enough curve in your lumbar spine or that low back, which creates no loading. And so these curves in your spine are meant to be shock absorbers. And so when we lose that shock absorption system, we start to load in a way that can compress into these discs. And when these discs physically lose their height, that's when the bone can start to rub on bone, and we'll see things like damage and arthritis and degenerative types of changes in the spine. And so based off of those factors, we take those x-rays to see, one, is there damage in the spine? What do these curves look like? Is there damage or instability we need to be aware of? And then it allows us to tailor those care plans to you personally to help you either gain more curve, take curve out of the spine, completely dependent on what that spine looks like for you, so we can tailor that care plan for you.